I'm Gary Nickerson,
And I'm Quinn Taggart.
and this is Outside My Window. Well, since most of the COVID restrictions have been lifted over the last while, Nova Scotians have been out doing things that they hadn't been able to do before because of those restrictions. You know, going to festivals, family barbecues, and all of that. But we need to be reminded that COVID is still around. And Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia, is our guest in this particular podcast. Dr. Strang, it's a pleasure to have you back.
Thank you very much, and I hope both of you had a good summer.
Has the overall COVID situation improved in these last couple of years, Doctor?
I mean, certainly we're in. I talk about it really. We're still in the pandemic, but we've kind of in three phases. The first phase, which was basically 2020, was when we had to learn a lot about the virus and how it's transmitted, and we did that. We adjusted even our use of the most strongest restrictive measures. We adjusted and had them more targeted over time. The second year was really the year when we started to roll out vaccines and built, and we still have that very good protection against severe disease here in Nova Scotia because of our high levels of vaccine coverage. And this third phase, which really started early in 2022, is about when we move away from the need for a very acute, focused, and a response that used restrictions and mandates, etc., more to a transition. And we're still in that transition, and it's taking a lot longer than any of us would hope. But of that transition to when the COVID virus becomes just one of a number of other respiratory viruses that are out there. So we're in the place now that we still have COVID around, a fair amount of it. We're coming out of, we had the seventh wave like the rest of the country did in July, and we're starting to come out of that now. But as we enter the fall, we're still going to have COVID around. We all know that even though we're still in summer, certainly in my world, I need to start thinking about influenza, and that usually starts to appear around towards the end of December into the winter. And so what we need to think about is the possibility of having COVID and influenza, but we still have to get through the fall when there's lots of COVID around. So my key message to Nova Scotians is that the pandemic's not over. We still need to take COVID seriously. It's different now than it was in those first two phases in 2 years, and we don't need restrictions and mandates, and people can be out and about doing things, but we have those personal protective measures that we still need to take COVID seriously and follow those measures to keep not just ourselves but those around us, especially of those in our communities who are at increased risk for severe disease from COVID because of age and or underlying medical conditions. We've done a good job, and especially in the first 2 years, about looking after each other and putting community and our collective well-being first. And we need to think about that and do that again as we enter the fall.
So how are we doing, Dr. Strang, as compared to other provinces, and then as a whole, Canada-wise, as compared to, say, some of the other countries like the U.S.?
So a couple of things. We have, if you look at through the whole pandemic, comparing to a number of indicators, whether it's cases, hospitalization rates, mortality rates, if you look at the whole pandemic, Nova Scotia's done well compared even to other provinces and territories. And there was some work that was published recently that looking at the first 2 years of the pandemic and a number of indicators saying that Canada had done very well compared to other similar type countries. But we also have to recognize, and partly because we did so well in the first couple of years, we had a lot more people who hadn't yet been infected. And even though they were still protected against severe disease from vaccines, we had high rates of infection in the spring, and we had certainly had significant amounts of infection, perhaps more than most other provinces in this last wave. But the good thing is that we had lots of infection our rates of severe disease were still quite moderate. So again, the vaccine our vaccine has not been great at protecting in 2022 against the Omicron strains, but has still remained very effective against minimizing the amount of severe disease and the number of people going to hospitals. So I think that's a key for Nova Scotians to understand about how important vaccines remain, and that even though recently we've had a lot of people ill, the number of people that are getting severely ill has, while it has, it has been, there certainly have been people in hospitals, and unfortunately there have been people that have passed away from COVID, but those numbers have been minimized because of vaccines.
What about second and third infections for some folks? I mean, are we keeping track of that? How many people that have gotten ill with COVID in the last little while have been the second time around?
So that's very difficult to keep track of. I mean, we certainly keep track of everybody who has a PCR test that goes a swab that goes to the lab. All of those that are positive are reported, but we're no longer following up those cases individually. So we really don't know who might be a first or second case. And then all the people who are testing positive with a rapid test, even though we're encouraging them to use the report and support tool, which is online or through 811, a lot of people aren't. So there's a lot of infection out there that we're not aware of. So we don't have a good handle. I don't think we're not unique, and nobody has a really good way of really keeping track of was it first, second, or even third infection. But certainly anecdotally, we know with these latest Omicron strains that people who were infected, especially with the strains that were around, the Delta strain and other things that were around before Omicron, can still get a second infection. But we do know that second infections tend to be less severe, and certainly people who are infected, even though they've gotten a vaccine, the vaccine is protective, as I said earlier, very protective against severe disease, and it also decreases the chance of people developing long COVID. The early evidence is pointing in that direction. So I may sound like a broken record, but I keep coming back to the absolute importance of people being up to date with their COVID vaccines.
With all of these variants coming up, and of course, I imagine there's no way to predict, as you mentioned, there's a new wave possibly expected this fall. Do you expect any variants? And do the vaccines have to be tweaked any by the pharmaceutical companies when these variants come up, or they appear to be effective?
So the first question, we don't know. So far, I mean, this latest wave was BA4 and 5, but then those were part of the Omicron family, and so far there does not appear to be any additional significant variants on the horizon. Although it's only the end of August, so nobody has a great crystal ball, but we certainly have to be prepared for the possibility of another variant to appear and create another wave, as I said, in perhaps in the late fall, early winter, along with influenza. We can't know at this point in time, even if there is a new variant, how different it's going to be. If it's just another Omicron-like variant, it's likely to be much less severe than if it's a significant change and a totally new variant, because we will have lots of people in the fall who are protected either from a combination of vaccination and recent infection with an Omicron strain. The second question is, it was announced today, Health Canada, that they have now licensed bivalent vaccines. So those are vaccines with an Omicron strain and the original virus strain as well. So that's just been announced today. We're waiting for the recommendations from the National Advisory Committee on Immunization. And we will, in the next few weeks, we will be rolling out the details of our fall COVID vaccination campaign and how the bivalent vaccines will play a role in that.
How agile are the pharma companies, in looking ahead? I mean, similar fashion to like a flu shot, most people already know how that part goes. You're taking a gamble on what you think the strains are going to be. Are we going to be in the same sort of situation here?
Well, I think what we might end up with is and this year is partly in on going down that direction, is like flu vaccine, that and I'm just speculating on this, but I think I think it's a reasonable possibility that we at least we develop an annual COVID vaccine. Based on the latest information of what the likely strain of the COVID virus is likely to be, and people who are at highest risk for severe disease may need to get an annual vaccine. That's certainly a possibility. But what we do know is that the bivalent vaccine, which Health Canada licensed today, that is the Omicron strain in that vaccine is the original Omicron strain, but that was around, it's around back in January, February. It still will be effective against the circulating strains, but so I think that gives you a guess. It's that strain didn't appear until very late in December 2021, and really was circulating in January, February, March 2022. So that's only 8 months ago, and there is work underway around another bivalent vaccine against the BA4 and BA5 strains. That's not going to be available right away, but that is being worked at. So I think both of those are really illustrate how responsive vaccine manufacturers can be, but you can't identify a new variant on one day and then have a new vaccine the next day. It does take some time.
The province has announced that more vaccines will be made available for children and adults. Are you still recommending that 168-day waiting period between the COVID shots?
For the majority of people, yes. So, and that 168 days is from your last dose of vaccine, or from if you fairly recently had a COVID infection, from the date when you were diagnosed with having COVID, whether it's a PCR test or you had a rapid test at home. For most people, needing to wait that 168 days. For people who are 70 years of age and older, and people with moderate to severe immunosuppressive conditions, and also women who are at the current time pregnant, we are shortening that time interval and saying that their time interval would be 120 days.
It was recommended that people wait until the fall for their second booster. And of course, that puts us into flu shot season. So is there a recommended wait time between the boosters and the flu shots, or vice versa?
No, the two vaccines can be given at the same time. For younger kids, we're recommending that they be spaced out a couple of weeks, just so we can be clear if there's an adverse event, especially, and parents are more concerned, that we can be clear which vaccine it was. But people are not going to have to wait significant periods of time, and ultimately we may actually get a single vaccine. It won't be available this year, but a single vaccine with both flu and COVID viruses in it.
And if we throw in the shingles and the pneumonia shot at the same time, we could have a one-stop shop.
Yeah, that's way more complex. Trying to bring those multi-organism vaccines, but we do it for childhood, right? Where we have 5 organisms in one vaccine. So down the road, who knows?
And what about oral? There's been some press about oral treatments being made available. Is that still in progress, or future development down the road?
I haven't kept close tracks because it's nowhere near completion. But I am aware that there is discussions and some research going on around orally administered COVID vaccines.
COVID vaccines, any kind of vaccines, only work if people get them. And you have warned, Doctor, about complacency. Can you expand on that a bit and your concerns there?
Well, I think we, along with other aspects of those preventive measures, but there's general kind of complacency around thinking that COVID is gone, we don't have to worry about it. But particularly with vaccines, it's going to be really important to. We did very well, especially with the first two doses, the primary series. We led the country in our uptake in that, and even our booster doses. We have certainly a greater percentage of the population 70 and above who have had taken advantage and had both their boosters than the national average. But certainly the uptake of the booster doses has been lower than with the primary series, and that's not unexpected with that happens with any vaccine. But I think it's important that people understand the virus is changing, and if they got vaccinated last spring, they by the time we get to the fall, their protection against severe disease may be starting to decline from the vaccine. And so the importance of getting an additional dose of COVID vaccine this fall is extremely important.
Now, the boosters are still a booster, like a half shot, right?
That's my understanding. Even the bivalent vaccine, it's a half dose, and you don't need the full dose because the primary series is already kind of your immune system has been turned on against this specific virus, and you just need to. The word booster is a good one. It gives your immune system a bit of a reminder, and so you can produce a high level of antibodies again against and now with the bivalent to be against the more the current strain.
One of the issues we're all too familiar with, and I know you are too, and that's these so-called experts out on social media, the keyboard healthcare expert warriors. Is it a never-ending battle with you and other health experts to get the true science-based information out there to people?
Yeah, it is challenging, especially in today's world when everybody just thinks they have information at their fingertips, but is it valid information? And there's a lot of misinformation, and there's some very focused, targeted disinformation campaigns. It's not just people unknowingly perhaps putting out misinformation. There's very deliberate putting false information out there as well through very focused and targeted campaigns. So really encouraging people to be very aware of where they're getting their information from. Do a bit of homework and make sure it's a credible site. And really, I would ask people to their starting point be either the Nova Scotia government. We have right on the front page a link to a lot of COVID sources, which also then link you through to the Public Health Agency of Canada. CDC Atlanta has a lot of good resources. Their stuff about vaccine is more American focused, but there's still a lot of good basic resources. So go to a credible kind of government-based site to get your information.
I've seen other posts too from folks that have said, I've never had a COVID vaccine, and I'm perfectly healthy. So how do you deal with that kind of, not that it's misinformation, but it's, perhaps making people think, well, if this person didn't get a shot and fine, maybe I shouldn't. How do you deal with that?
Well, that's where it comes down to developing, hopefully having a trusting relationship with people who are listening, and hopefully people willing to say, I'm going to listen to somebody who understands the science on this, and not some anecdote. There may be some people who, despite getting unvaccinated, don't get severely ill. But what we do know is that your risk of getting severely ill is many, many times greater if you're under-vaccinated, and even more greater if you have no vaccine. So it's kind of, do you really want to take the chance? And just because somebody has, been one of those statistics who was lucky, it's about the amount of risk that you're willing to take. But it's not just about risk for yourself; it's a risk for others around you. Because if you get it, then you're going to be able to pass it on to other people around you. And then also, you may be in a place where you need care from the healthcare system, which is extremely stressed at this point in time. So, I certainly feel we also have an obligation, not just to ourselves, but to keep those around us safe. And getting vaccinated helps with that, and also making sure that we're doing what we can do to minimize the chance that we need to use our healthcare system, because there's certainly lots of people who need that for all sorts of reasons.
Are we at a point, Dr. Strang, with the healthcare system as it is right now to kind of declare a state of emergency on this?
No, I'm saying that from the perspective, not, and a lot of the pressures in the healthcare system are not due to COVID.
No, I guess I should back up and say that. Yeah.
Certainly, COVID has certainly added additional pressures. Um, uh, uh, I can't comment on that with state of emergency, and that's not my work directly. But there is a lot of very positive things happening around reopening surgeries. We saw yesterday in a further step in increasing access to virtual care. Doesn't mean there's not still a lot of challenges around accessing care, especially primary care, but lots of good things are happening as well.
When it comes to restrictions, I mean, I know for the most part restrictions are clear, but other than hospitals, are there other places that still have some restrictions in place?
So the hospitals, some other kind of community-based healthcare clinics and those kind of things also have. I mean, I consider them as part of the healthcare system. Our long-term care facilities as well. Certainly not the level of restrictions and mandates we had even 6 or 8 months ago, but certainly we'll need to continue to have some higher level of preventive measures in place in long-term care facilities. And that's simply because those residents are, because of age and underlying health conditions, tend to be at the greatest risk of having severe illness and even dying from a disease like COVID.
Just to talk a second about the current reporting. So I believe you're at a weekly basis for COVID reporting, but with that less frequent reporting, from an average citizen point of view, what should we take away from the reports? Are there certain pieces of that we should be really paying attention to, or is it just really tallying the numbers?
I think just looking at the numbers, but I even try to emphasize to people that those, with the weekly information's there. Lots of people like to see that, but the bottom line message for me is that we have COVID around, and it's going to be, and we have it around in the province. So don't pay as much attention to the numbers, but just recognize that there's certainly a possibility that if you're out and about in your community, no matter where you are in the province, you might be exposed to COVID. So take the basic preventive measures, and that's going to continue through the fall. And we'll see what the winter brings. But I think people sometimes get a false sense of security or a false sense of alarm looking at the numbers, as opposed to, yes, COVID is now, the virus that causes COVID is part of our lives. It's around here. It's not going away anytime soon. So we need to continue to live life in a balanced way, but we need people to still, in that balanced manner, as they're still out and about doing things that we didn't do over the last couple of years, we still need to follow some basic preventive measures, each of us.
We chat a little bit about flu season and getting your shots and the like, but technically, when does flu season start? Like, is there a date range that makes sense for that?
When we typically, we say officially flu season is really from like the 1st of December through till the end of March. In Nova Scotia, and sometimes we get occasional positive flus out either before or after those dates. Where we typically see the increase in flu activity, typically in Nova Scotia, typically occurs towards the end of December into early January, and we typically see that continuing through the end of March, sometimes into April. Last year was very different. It was a very late season. I think that was related to the dynamics with a similar type virus, COVID, and some of the measures that were in place and then were lifted. But typically, it's flu season in Nova Scotia is from late December through until early April.
And at what point normally are the flu vaccine or flu shots made available?
We normally do those sort of middle of October through till middle of December, where we encourage people to get their flu vaccine. So we'll be talking a lot more about this as we start in the next few weeks. We'll be talking a lot more. Now we have the licensure of the bivalent COVID vaccine, and the NASA recommendations coming today as well, later today. We'll have a lot more to say about what our fall COVID vaccine program will look like, and then we'll also have much more to say about the details around flu vaccine and as well. But people should be looking for flu vaccine again from middle of October onwards is when we really start to make it available.
Now, obviously, COVID has dominated your desktop for the last couple of years. But what else should we be made aware of? What else is Nova Scotia Health working on?
I'll talk about public health, which is, Nova Scotia Health. The majority of work that Nova Scotia Health does is in delivering health care, primary care, hospital-based care, etc. So I'm in the world of public health, where we're all about prevention. How do we actually prevent things from happening? So, and there's public health is in the Department of Health and Wellness as well as in Nova Scotia Health. The things we're looking at in public health, there's a whole range of things. We're dealing with monkeypox, even in the infectious disease world. We have tick-borne diseases like Lyme disease and now anaplasmosis. But we've got lots of other types of issues around working with our partners in education around creating health-promoting school environments, working with our partners in mental health and addictions around creating communities that better support mental health, that how do we create environments that have more appropriate use of substances like alcohol, tobacco, cannabis, dealing with issues around street drug use and the potential for overdose, etc. So I could go on and on. There's a lot of issues and a lot of work that we had to put aside over the last 2 years for COVID that we're very anxious and need to get back to working on those issues as well.
I mean, certainly the last couple of years have drawn mental health to the forefront. Not that it wasn't there before, but certainly more so now. Do you think we're a little light on resources for mental health?
In healthcare, you can always look at ways that you may need more additional supports and resources, but also I think we need to look at how we're using the existing resources that we have and use them perhaps differently. And I know there's lots of good things are happening to both build capacity in around mental health, and whether it's improving access online, virtually for mental health supports, and creating different environments that are more community based. But when we talk about mental health, that I think there's an important conversation that we need to have. That how do we create communities that are more supportive of each other, including supporting people that are having challenges in their lives. Much of what happens with people when they have challenges with mental health, it's around loneliness, stress, maybe it's tied in with substance use, and it's not always just people with a diagnosed psychiatric disorder, but people who are having challenges in their lives and they need just care and support. It doesn't necessarily mean they need that support from whether it's a psychologist or a therapist or a physician. That needs to be part of it, but we also need to look at ways how do we build communities that look after each other more. So if somebody is struggling, they first of all, they feel comfortable in saying, I'm not doing well mentally, I have challenges, I'm feeling stressed, I'm anxious, whatever. That's a real issue we have around just those barriers to people even acknowledging that they're not doing well from their mental health perspective. But then also, how do we have communities that just kind of move in and support people? Because life can be challenging to all of us, and all of us have times in our lives that we need additional supports. And it doesn't just have to be a structured health system that's there. We need communities that better support each other.
Is there a model to base that on, or is it just a matter of having to cobble it together on your own based on what's available in your area?
So I think there's lots of work we need to do to kind of rebuild that. We used to do that more. I think people at one point in time, because of isolation and things, and we had larger families, and people did have communities around them. We had more reliance on kind of faith organizations and things like that. And so how do we? I think to me, it's not that the health system that builds it, but the health system needs to work with communities to say what would it take to kind of build or rebuild more of the communities that better support each other's both mental and physical health.
I wanted to ask you about monkeypox. So, what is it? How is it transmitted? And how concerned should we be?
So monkeypox is a virus that we've known about since the 70s. It's historically has been in West Africa and was usually related to direct transmission between animals and humans. This latest version of monkeypox has changed and is now able to be transmitted from human to human, but it's very different than COVID. It is transmitted only, all the epidemiology showing only through very close, intimate skin-to-skin contact. It is not transmitted by casual contact with somebody shaking their hands. It's not transmitted by people coughing and sneezing unless it's you're very close ongoing contact with them. So for the general public, this is not any substantive risk at all. They're not at risk for monkeypox. There are very focused groups that around the world where this has been transmitted, and it's not going from those groups into larger groups, into the general population. So certainly people like myself in public health need to take this seriously and pay attention to it. We are. We'll have much more to say in the next few days, next week, around a very targeted vaccination program for very specific groups of people who are at increased risk of perhaps being exposed to monkeypox. But I think the basic message for Nova Scotians is that this is a very different disease from COVID. The general public is not at any substantive risk from monkeypox, and so it's like other diseases where there are certain groups in the community are at risk, and we'll focus our preventive efforts with those groups. But the general public does not have to have great fear or concern around them potentially being exposed to monkeypox.
Nature is always going to throw something at us. Is that not true, Dr. Strang? Whether it's a different new bacteria or a virus, it's just something I guess that we have to expect in this world.
You're very right in that comment. So, in the last couple of years have been showing us, we've had we knew at some point we were going to have another pandemic. Where most people were thinking about another influenza pandemic, and lo and behold, we had a COVID virus pandemic, and now we've had, as I said, it's very different, but we now have a new type of monkeypox arising. And so there's always this world of infectious diseases that, and I think the reality is we're going to see more of these type of things as the world's population continues to grow. We are pushing more and more into very remote places where there's increased likelihood of an interaction between animals and humans, and that's where most of these new types of diseases will emerge from. And on top of that, I don't want to be gloom and doom, but we have our climate crisis in front of us, where we've had extreme heat, forest fires, flooding. All of those events create their own issues, whether it's related to increased risk of infectious diseases or people being displaced from their homes, all sorts of things that are going to create these kind of crises that affect people's health. And so we have to be better prepared for a whole range of types of emergencies, not just for infectious disease emergencies.
I was just thinking aloud, as I probably should during a podcast, especially since Omicron. Do you think perhaps it has inspired a whole younger generation of people to kind of look into whether it's going into a field like yourself in public health or perhaps in microbiology? What are your thoughts there?
Sort of in my field in public health, which has often been kind of gone under the radar. You know, even when I went to medical school, 4 years, I had one small lecture on public health. So hopefully there's a greater awareness of what public health is, the work that people who are trained in public health do, and the importance of that work. And if that excites people to get into this field, well, that would be wonderful.
Finally, Dr. Strang, on a personal note, have you been able to take some time for yourself and your family these past couple of years? Because I know prior to that, you're a little busy.
Yeah, no, it was extremely busy, but I was fortunate, and I was actually allowed to be off. Other people covered for me, so things were looked after. But I was actually able to be off for June and July. Thank you for asking, and was able to spend much more time with my family and all of us kind of rest and recover from the last 2.5 years. But I'm back at work now and got my sleeves rolled up, and still lots to do.
So, just as a bit of a recap, Dr. Strang, and a bit of a final word, what's your advice for us in the next few months?
So I think it's I use the word balance a lot. So we need to take COVID seriously and the possibility of flu season, but we don't have to be paralyzed by fear about it either. And we're not at a point right now where I would, using mandates and the strong restrictive measures. COVID and influenza are with us, are part of our world. So what do we do, starting with getting vaccinated when we have vaccines available to us? Other measures, like when we're around other people in crowded indoor places, people should still be wearing masks, being careful about how we gather, especially with people who are elderly or have underlying health issues. Those are just basic things that we need to continue to incorporate into our lives while we go about doing all the things that we normally do.
And if people are going to go online and get resources, make sure it's a reputable source, like hitting the Nova Scotia Public Health website.
Absolutely. There's lots of credible information there. And my bottom line, if you're getting things from Twitter or Facebook or other of those social media feeds, it's probably not valid information.
Indeed. Check your facts.
Dr. Strang, it's always a pleasure for Quinn and I to speak with you. We thank you so much for your time.
I appreciate it. Thanks very much for the opportunity. You have a good day.
I'm Gary Nickerson.
And I'm Quinn Taggart.
And this has been Outside My Window.